In this lecture, we will be discussing about the QT interval. The QT interval on the electrocardiogram is measured from the onset of the Q to the end of the T. Now, these are very important endpoints that should always be kept in mind when interpreting the QT interval. So, I have highlighted the interval over here as well. Another important aspect that should be beared in mind when interpreting the QT interval is the leads in which to look at. So there are some leads that can be very helpful when you are looking at the QT interval. So these leads are lead 2, lead V5 or lead V6. These leads are important because you can clearly see the endpoints of these two complexes. And one again important aspect that should not be forgotten is that you always have to measure on the normal standards, which are the 25 millimeter per second speed and 10 millimeter per millivolt amplitude. There is one thing that can cause a confusion when measuring the T wave, and that is the U wave. Now, U wave can be seen in some of the leads, and in that case, it can be either superimposed or inseparable from the T waves. So, here you can see a T wave, and this is the end of the T wave, and a U wave is clearly seen over here. So, sometimes when this U wave merges with the T wave, then this causes confusion, and in that case, you have to look at the leads which do not show the U waves. So in that case, always try to look at the leads AVR and the AVL because the U waves is oftenly not seen in this ECGs, and it's pretty easy to measure the QT interval in that case. Now let's look at the intervals. So we need to know the normal intervals. So anything below normal or above normal is abnormal. So for the female, the normal interval is 430 millisecond, and for male it's less than 450 millisecond. Anything more than 450 in females and more than 470 in males are prolonged QT. There is a concept of short QT as well. Short QT is usually seen in congenital cases and sometimes rarely in some other disorders. Short QTs have been linked to some arrhythmias which can be life-threatening, so they should always be kept in mind. The values for short QT are less than 340 for females and less than 330 for males. There is a relation of the QTC with the heart rate. So these are important aspects to consider because the heart rate, if changes, it can change the QT interval as well. So that is important thing to be noted whenever interpreting the reports. In the case of increased heart rate when the patient is doing exercise, the QT will shorten in healthy individuals. Similarly, when the heart rate drops down and goes into the bradycardia range, the QT will prolong. So this also should be beared in mind when interpreting the QTC. Because of the variability in the QTC depending upon many factors including the heart rate, there is a formula that has been designed that is called the Bazer's formula. So whenever you are interpreting the reports, then always mention the corrected QTC. How do you calculate this corrected QTC is by taking the QT interval just from the start of the Q to the end of the T and dividing it by the square root of the RR interval. Now let's apply this formula. So this is the ECG of one of the patients, and now what do you think the QT looks like? So is it prolonged, is it normal, or is it short? Now let's look at this. Important aspect that should not be missed before going on to measure the QTC is the presence of the U waves. So this was the same patient now, and we can see that some leads are showing the U waves, which we can see here marked by the arrows in the chest leads. However, on the right hand side, we can see the limb leads from the same patient, but we cannot see any U waves. So these are the good leads to interpret the QTC. Now look at lead 2. We can clearly see the end of the T wave. So this lead should be taken for measuring the QTC. Now let's calculate the QTC interval. First of all, we need to calculate the QT, and QT in this case was zero point 0.4 second. The RR interval was 0.92 second. The corrected QTC as per the Bazer's formula is 417 millisecond, and this means that it is a normal QTC. Now have a look on this ECG. What we can see in this ECG is that we can see some T wave inversions, and the QTC in this patient looks a bit prolongish. So for that we have to measure some intervals. Now let's zoom in and see the leads. Now we can see the onset of the Q and the end of the T, and it looks to be a bit prolongish. So now let's measure these intervals. Now after applying the formula, we can obviously see that the QTC, which was looking prolongish, is definitely prolonged, and the value is around 500 millisecond, and this is pretty high for a QTC, and this should always be taken care of, because these long QTs are associated with a particular type of arrhythmia that we call as a polymorphic VT and torsade D points. Especially these arrhythmias can be life-threatening, and they can degenerate into ventricular fibrillation. So they should always be managed timely. The most common method of managing them is doing the cardioversion. So they should not be delayed, and obviously after managing these arrhythmias, the long QT should be taken care of.